Hi, my name is Katie Miller, and I'm going to be talking to you guys about background and foreground questions. All right, so we've had 5 steps that we've really focused on all semester, and when it comes to forming background and foreground questions, um, that's what we always start with. So step 1 will be to ask a focused clinical question. So throughout this whole PowerPoint, we're going to basically be on number 1, step 1. So when we begin formulating these questions, that process involves identifying a need for the information and then constructing those questions. So you might wonder, well, where do I get these questions from? You can get them basically from any part of your practice. So just to choose a few that you can focus on the examination, evaluation, diagnosis, prognosis, intervention, or outcomes measurement. So anything around those topics would be a great place to start when forming your background and your foreground questions. Is the background question. The second one is the foreground question, and we'll go into detail on how to create those in a second. But when you're thinking about your background question, think broad. So don't think very specific at all, just big picture. When you think foreground, that's when you start getting very specific on each component you're working with. So we'll go a little deeper in a second. So when we're looking at a background question asks about general information about a condition, test, or treatment, and it's not specific to an individual patient. So these are things that can be easily found through in a textbook we have. You're not going to have to do a lot of digging, just very broad. And we're going to practice in a little bit differentiating between a background and a foreground question. But when building your background question, there are 2 components you need to make sure that you have. So the question root and verb, and then whatever the test, condition, or treatment is. So here is where we get very specific. So what is a foreground question? A foreground question or foreground questions are questions structured to help you find the best available research evidence as efficiently as possible. So these are things that you are not just going to easily find in a textbook or maybe even a search engine. You would have trouble. I'm sure a lot of us had trouble just finding our foreground question because it was very specific, but the more specific, the better. So there are 4 elements that help guide us when we're building these questions because they are a little bit more in-depth than the background question. So we're going to go and learn about PICO in our next slide. So the acronym PICO will help us create our foreground question. So if you can remember PICO and remember what they stand for, then you should be good to go when creating this question, this foreground question. So P is the patient or the population and clinical characteristics. I is the intervention. C is what you're comparing the intervention to, so maybe an alternate intervention. And O is the overall outcome. So that is PICO. So now that we've learned about a background and a foreground question, we're going to see if you guys can differentiate between each of those questions. So if you want to just pause me or just go ahead and read the questions. So how is type 2 diabetes managed? What causes depression? What is temporal arthritis? Well, those all sound pretty broad. They don't really include an intervention or an outcome. They just kind of keep it short and sweet. So if you guessed background question, then you were right. These are examples of some background questions. If you want to go ahead and read these sentences and decide if it is a background or a foreground question, I'll go ahead and read the first one. What are the effects of prolonged bed rest on patients with severe scoliosis and lumbar surgery? So if you just take a second, you can almost instantly tell that that is a lot more specific than the previous slide. So if you guess that these are foreground questions, then you are correct. They're a little bit more in-depth. They're a lot more specific. So I know we've had a lot of practice this semester, but just in case you need a refresher, I created a little case study so you can kind of convert this case study into the PICO format, which will end up having a foreground question for this. So you're a PT/OT working at an inpatient pediatric clinic. A third-year OT student comes to you for consultation after observing your patient. The student wants to discuss options for poor behavior in the classroom with children with ADHD. She wants to know if medication or occupational and physical therapy would be more beneficial to this child in reducing outbursts in the classroom setting. So you can stop here and try to pull out the PICO. So pull out the P, the patient, I, intervention, C, the comparative intervention, and then the outcome. So if you want to check your work, here is PICO, and I've kind of outlined what PICO is in general and then what it is in a foreground question that could come from the previous case study. So a background question that you might want to ask about that case study is something very general. What are typical behaviors of a child with ADHD? And then if you want to take it one step further, you can always add that foreground, very specific question and make sure to go back to PICO to check if you've hit each component, and then you should be good with your foreground question. So for the P, we have children who have ADHD. The intervention is medication. The comparative intervention is occupational therapy and physical therapy. And then the outcome is to reduce poor behavior in the classroom. And here are my references. Thank you.